of Saskatchewan's COVID-19 panel addressing your concerns. I want to thank you all for attending today, and it's great to have you here. My name is Sean Wiscar, and I'm one of Municipalities of Saskatchewan's advocacy advisors. I want to thank today's webinar sponsor, Sumisure. Thanks to Sumisure, all of the Municipalities of Saskatchewan's webinars are now free to all of our members. As you know, we are all now using Zoom. You can see the icons available at the bottom of the screen. You have your audio settings available at the bottom left of your screen. So if you're having problems with the audio on your computer, you can always switch to listen through phone audio. We have Q&A for questions. Please note that you have your choice to send your question anonymously, and questions can only be viewed by us, the panelists. You have chat for comments and conversation. This is what you'll use to tell us if audio is unclear or you're having trouble understanding something, as well as the raise hand function, which we'll be using if we have any technical difficulties or need any last-minute feedback. Today's webinar is going to follow a different format than our members are used to. For the next hour and a half, we'll be taking questions from the audience up until we hit 11:30 a.m. For the sake of our audience and our presenters' time, we will not be taking any questions from the chat pod, so all questions must be put in the Q&A pod. We will also not be taking any questions that only apply to one specific municipality. Please submit all of your questions now, as we will be going in order of submission. If you want to have your question asked, we ask that you submit it as soon as possible. Any questions that are unanswered at the end of today's presentation will be forwarded on to the panelists to be directed to the appropriate person to answer them. But please give our panelists some patience, as they're all extremely busy people and they may not have a chance to get to your question. And sorry folks, I just have a quick technical difficulty. Okay, I fixed it. I now want to introduce today's speaker. I'm going to give each of them a couple minutes to introduce themselves and talk about any relevant information that they would like to disseminate to you, the attendees. After that, we'll be following introductions with Dr. Shahab, who will give a quick presentation, and then we'll jump right into the question and answer. So I'm going to start with Verona Thibault, CEO of the Saskatchewan Economic Development Alliance.
Thanks, Sean, and good morning, everyone. I manage a provincial nonprofit that some of you may be aware of. We support community and economic capacity across the province. And of course, our focus and priority right now is on economic response and recovery. At the outset, I want to refer folks to our landing page at saskresilience.com. It has the resources and tools that will support you through this process, and we're certainly available to provide one-on-one coaching as you move forward. I do want to emphasize this morning the importance of having an economic response and recovery plan in place. And the tools, again, are online, and I can certainly help communities who do not have one in place get that up and running. Part of the immediate business response is doing outreach with your business base. And so I would strongly encourage you, if you haven't already, to update your business database, reach out via email, telephone, establish a hotline. Information on how to do this and sample surveys are online on our website. It's important right now to determine their immediate needs and their forecasted needs in the future, and for the community to be a support group for your local economy and your local businesses. It's going to take a community to come out of this and to support our businesses moving forward. There's lots of action items that your response team could move forward with. I'm not going to go through them all now. We have some examples on our website, and maybe some will come up in the questions today. I do feel that it is going to take community investment in some cases to retain our local businesses and or to replace businesses with other services and products. So that's something to consider in moving forward with an economic plan. How can you raise local money through investor groups or other means? We are starting our own resilience webinar series next week. And some of the topics we're going to cover over the next 6 weeks are how can you raise local money? What are some opportunities to develop investor groups to support your economy going forward? And of course, to underlie all this work that is facing communities is to make sure you have an expanded volunteer network in place and a good referral network. And I look forward to answering any questions that arise this morning.
Thank you very much. Next, we'll go to Kerry Kempf, Executive Director of Enterprise Projects and External Relations from the Saskatchewan Public Safety Agency. And Kerry, I just believe we've muted you, so just hold on 1 second. There, go ahead, Kerry.
Good morning, everyone. Thank you for allowing me to join this forum. We are coordinating the rest of government's response and supporting Dr. Shahab, the Ministry of Health, and the Saskatchewan Health Authority as they take us all through this challenging time. We are running a 1-800 line for non-health general information as well as reporting of potential violations, and I think that number has been circulated and posted quite well, so I won't go into that now. And then lastly, just a shout out to you leaders who've done an excellent job stewarding your citizens and your community members through this process. And I hope that this is helpful for you today.
Thank you very much, Kerry. Next, we'll have Bonnie Chambers, Executive Director of Advisory Services and Municipal Relations from the Ministry of Government Relations, introduce herself.
Thanks, Sean. And hi to everybody today. Most of you people in the municipalities already know who I am. As the Executive Director of Advisory Services and Municipal Relations, you know that my team provides technical assistance to municipalities on municipal administration, to municipal officials, whether they're elected, administrators, or the public. As a level of government, we support municipalities as looking after their citizens. A few things that we are doing throughout this COVID-19 is twice a week, municipalities will receive a newsletter and it'll have information based on the questions that we are hearing. It's not just from advisors, it's also from our community planning branch, our municipal infrastructure branch, and our policy branch, as well as Northern Municipal Services. So look for that in your email each week. And I am just happy to be here and happy to answer your questions. So thank you.
Thank you, Bonnie. Next, we'll have Tim Mccauley, Director of Environmental Health from the Ministry of Health, introduce himself.
Good morning, all, and thank you for having me here today. My role in this whole serious public health threat state of affairs is to work closely with Dr. Shahab in development of public health orders that apply throughout the province. If you haven't seen the orders, they're posted on the Government of Saskatchewan website and query COVID-19 public health orders, and the most current ones the most current order will be found there, that being April 4th of 2020. We've worked very closely with other agencies, including the Saskatchewan Public Safety Agency, as well as police organizations in terms of enforcement. We definitely have a close tie with the Saskatchewan Health Authority and their public health inspectors, who are the leads in terms of enforcement of the public health officer or the public health order. We've established a 1-800 number for police to call to get current information on COVID-19 cases. And yeah, we're also relying on community leaders and members of the community to be vigilant in ensuring that businesses and members of the public are following the requirements set out in the order. Thank you.
Thank you very much. Next, we'll go to Dr. Ross Findlater to give his introduction. And sorry, yeah, you're on mute.
Yeah, no, I'm not used to getting a big message in the middle of my screen to unmute my my microphone. I'm a public health and preventive medicine specialist, and I'm really a general support to Dr. Shahab. Most of the work I do is involved in surveillance, sort of tracking disease counts and the background to the public health measures that are there to try and prevent spread of the infection. So it's a lot of communication, like anything in this kind of type of emergency with both the SHA, the Saskatchewan Health Authority, and other jurisdictions.
Thank you very much. And last but certainly not least, the busiest man in the province, the Chief Medical Health Officer, Dr. Saqib Shahab.
Thanks, Sean. So I'm Saqib Shahab. I'm, as Sean said, the Chief Medical Health Officer, and I work with the team both in health and the Saskatchewan Health Authority, but also within government with many sectors. And what I thought was I'll just give a bit of overview of where we are today, April the 7th. And I'm not going to talk too much about the projections for the future. There's going to be some public releases of projections tomorrow, but I think that that is just something that we need to keep an eye on, and we can't say too much about, more than 2 to 4 weeks from now. But I did want to just say that, we are only in our 4th week in Saskatchewan of our pandemic. The rest of Canada is maybe in their 8th week. And of course, as a global community, we are starting our fourth month. So obviously the pandemic is rolling out at varying stages. I'm not going to go through all the epi information that is on our website, but we have to recognize that the government of Saskatchewan has put in unprecedented measures at a business and society level, which relies on the collaboration and cooperation of all citizens of Saskatchewan and, of course, all businesses and municipalities. And based on that, so far into our 4th week, we feel that we have been very successful in keeping our so-called curve as flat as we can. This is allowing the health system to prepare for what may come over the coming weeks or months, and we can't really predict what an impact it will have on the healthcare system, but certainly the healthcare system has to be prepared to see an increase in cases needing care. But on the other hand, I think what we are doing is essential to minimize impact in terms of adverse outcomes, in terms of illness and death. Having said that, there are certainly costs to doing that. There are personal costs as we practice physical distancing. We do not meet friends and family outside of our household. There are community costs in terms of closure of many businesses and recreational facilities. And we have to be aware of those costs both from a psychosocial perspective and economic perspective, as the panelists before me mentioned. And we already need to keep an eye on, how long we can sustain these public health measures, and of course, once we are able to ease back and recover. And that would not be my area to comment on, but it's just something that I think all of us are acutely aware of as well. And finally, I'd just like to say that I'm really glad that Dr. Findlater, who was the previous Chief Medical Health Officer, and Tim Mccauley, who has a long history of working in government, are here to support me in answering specific questions that you may have around municipal roles and functions, how we can work together more collaboratively, how you can connect with public health inspection and medical health officers at a local level. And we'll try to answer all the questions as best as we can today. But if there's questions that we need to take back for consideration, I hope you'll bear with us to take those back and give a more considered response in writing that I assume Sean can share with the membership as part of this ongoing collaborative discussions that we will likely continue to have over the next little while. Thank you.
Thank you very much, Dr. Shahab. So with that, we'll jump right into the questions. For our panelists, how it's going to work is I will direct the questions to specific people, but if you feel that you have something important to add, feel free to jump in and add. So our first question goes to Bonnie and Verona. Is it recommended to wait to bring seasonal employees back until we have a better idea of how long this pandemic is going to last?
I'm not sure if Bonnie wants to weigh in here. I really feel as part of an economic recovery plan, the communities need to start looking at what does that future look like in terms of labor and in terms of their community in general. What does public spaces look like as we move forward? And maybe that's something some of the other panelists can jump in on. Our tourism industry itself also incorporates community-based enterprises such as museums. I really feel protocols have to be put in place, and I'm sure other panelists here might want to speak to that as well.
And if I could just add to that, Sean, I would say that I agree with what Verona said. It's not a question that we can say yes or no to. Each council would have to delve into that on their own, but they also have to be mindful of public health orders, that type of thing, and all the restrictions. Right now, your citizens need you to be a leader and make decisions that are the best for your citizens. So.
Thank you very much. Next, this question goes to Dr. Shahab and everyone from health. With warmer weather coming, should municipalities prepare to have a swimming pool season? So a season where people can have kind of bigger gatherings and they can be out in public spaces such as swimming pools.
So maybe I'll make a few comments and maybe ask Tim and Ross if they want to add to that. I think, and this also relates to the earlier question as well, I think right now we're pushing very hard to contain the pandemic in Saskatchewan. And so we are really wanting to minimize any mixing between households. And the only work that is being supported is essential work, so that's healthcare, other work that supports essential supplies like groceries or utilities. We foresee certainly in the near term, maybe 4 to 8 weeks, that we need to sustain this. Having said that, we need to recognize that one of the Saskatchewan advantages is that we don't have large urban centers, and it is perfectly safe for all people in Saskatchewan to enjoy outdoor green spaces in a safe manner, maintaining that physical distance, while even there we don't encourage interactions between households, even for children, because that can be a source of transmission. So that's what we want to sustain for the next little while. But obviously, as we see how this pandemic unfolds in Saskatchewan, there will be some review of what is allowed and not allowed over summer. It's too early to say when that will happen, but certainly all this is reviewed on a weekly basis. And certainly, I think as we go into May, June, some of these things will have to be reviewed, and we could provide a better direction at that time based on what is the local transmission and what further measures can either be strengthened or can be relaxed. So that's the best answer I can give at this time. So basically, in short, there's no plans for reopening swimming pools at right now, but that decision may come up at a later date. And I'll just pass it on to Tim and Ross if they want to add anything.
Yeah, it's Tim. At this point in time, the public health order is quite explicit that recreational facilities such as a whole list, including swimming pools, are to be closed for the public. And I just want to explain to the membership that in addition to what Dr. Shahab just stated in regards to the context and why we're why we're closing these types of facilities, we also are monitoring what other provinces and territories are doing throughout the country in regards to invoking restrictions that are aimed at lessening the transmission of COVID-19. And so when we look at recreational facilities, we're in line with other parts of the country, so it's not just Saskatchewan that is closing swimming pools at this time.
Perfect. Thank you very much. This next question goes to Kerry, but also we will go after to Dr. Shahab for his perspective. The question is, for the most part, our public employees keep to their own equipment and can do their jobs while distancing. However, we do hold safety meetings, which involve employees coming together back to the RM shop. We usually have to have our 20 public works employees in the same space. Is there a safer way to carry out this daily task?
We have been making use of virtual technology. You have to comply with the public health order about gatherings. A safety meeting certainly qualifies as a gathering. One of the other options that we're using here that I would recommend is having people do shifts. So we might have had one meeting, if it absolutely has to be face-to-face, we now might be having 3 or 4 in order to include the whole group. But certainly virtual is best.
Dr. Shahab, do you have anything to add?
Yes, certainly. I would really support that approach, and thank you for explaining it in that way, because what we have noticed is that for people who still have to go to work in different sectors, they still have to practice physical distancing and hand hygiene and cough etiquette very consistently. And we have actually seen transmission happening where, you know, work is a familiar surrounding. So even if you think you're practicing physical distancing, you may sit closer together for a meal or a snack or pass things around, and transmission can happen in those settings. So a workplace is not a household. Within a household, of course, if no one is sick, we can interact in a very different way. But for workplaces, I would fully support virtual meetings where possible, and where people have to be in one place, like in healthcare or other sectors. It's really important to maintain that physical distance among each other. And then, of course, while you're dealing with external clients, either maintain a physical distance, or where that's not possible, as in healthcare, use additional precautions. Thanks.
Thank you very much. Another question to you, Dr. Shahab. Should municipalities be planning to provide PPE, so masks, to essential workers such as waste collectors?
Yeah, so this discussion has evolved over the last 3 days, if you've been following the media. And so this is what I would say today. And of course, this is an ongoing area of discussion. So for the general public, the recommendations have been to maintain physical distancing at all times, good hand hygiene. There has been now recommendations to wear homemade or cloth masks, not the medical grade. And the advantage of that primarily is that if you are asymptomatic or mildly symptomatic and are in a situation where you can't maintain that physical distance, which we don't have a lot of those situations, like mass transit kind of situations, then a mask prevents you from infecting others if you were to cough. And of course, we always say cough in your sleep or use a tissue paper to cough. So there is some additional benefit beyond physical distancing of using a cloth mask. Of course, medical grade masks and N95 masks are used by healthcare. The medical grade masks are used when you're providing care to people who are sick, because they prevent transmission from a person who is ill to a care provider who is working in close proximity, and vice versa. And again, I'll defer to Tim in a minute, but I don't think if you are a municipal worker, as long as you maintain good hand hygiene, if you are managing things like garbage collection or other workers, as long as you maintain good hand hygiene, which means washing your hands before eating and drinking or after finishing your chores, and not touching your eyes, nose, and mouth while working, I don't see any additional benefit of any additional PPE. Having said that, if municipal workers want to wear eye protection, which may be part of the job anyways, depending on what kind of work it is, or want to wear a cloth mask, that may provide some additional level of protection, but I would not make that mandatory unless it is a part of the occupational health risk assessment in any case, in terms of preventing, even when there's no COVID, of preventing any articles impacting the face or other, gloves and other things that would be a regular part of the job in any case. Tim, would you want to add something to this?
Only that the ministry and staff within the ministry have been working day after day in trying to get information up onto the government website dealing with COVID-19. There are many information sheets that are up there that can answer some of the questions that most of the public have. In specific, there is one for PPE and advice given for different workplace scenarios or sectors as to the appropriateness of the type of PPE that should be used. Just as there is one on a general information sheet dealing with workplaces and what can be done to mitigate the transmission of COVID-19.
Thank you very much. Our next question is going to go to Bonnie, but if Verona or Kerry, if you have anything to add, feel free to jump in. We're getting a lot of questions around holding council meetings and holding elections coming up here in the spring. So the question is, how can municipalities still comply with the health orders of no more than 10 in a group, as well as social distancing, while still handling their legally obligated meetings, as well as their legally obligated by-elections?
Okay. Thanks for the question. We have been encouraging municipalities to hold conference calls, as Kerry talked about virtual meetings. Municipalities will have to abide by the legislation which allows the public to hear the council meeting. We know of some municipalities that are live streaming their meetings where the mayor and the administrator might be in the room and the rest are calling in on conference calls so the public can hear it. So in some ways you may have to get creative to do it. As for by-elections, we also know that many of the municipalities have postponed their by-elections. I also want to address that resort village elections are coming up in July, and the province is looking at that. So hopefully a decision will be made on those shortly. So we are aware of that. If you have specific questions on council meetings and that, feel free to contact one of the advisors. So I don't know, Kerry can add to that.
No, I would recommend the same.
Perfect. Thank you very much. A question for Dr. Shahab. If you've already had COVID-19, is there a risk of you contracting it again?
So that is a very important question that is being researched actively right now in Canada and other parts of the world. At the moment, our recommendation is that if you have had COVID-19 and have fully recovered, and we have to now also recognize that many people who have gotten COVID-19 in Saskatchewan are recovering. So most people actually recover fully, but unfortunately a small percentage, 20% or less, require hospital care. But at this point, we cannot say definitively that if you have had COVID-19, you are immune for a certain period of time for getting reinfected. But I think that is an area that is being actively researched, and over the next few weeks, 4 to 8 weeks, I would say we should have a better answer for that. Thank you.
Thank you very much. A follow-up question to you, Dr. Shahab. There are increasing reports of other provinces saying they're running short on PPE. How is the supply in Saskatchewan, and are we expected to be able to keep up with demands?
So again, that is an area which the Saskatchewan Health Authority, along with the Ministry of Health, is looking at very closely in terms of what our current stockpiles are, what are the timelines for future orders to be fulfilled, while recognizing that at this point, we at any given day have only 4 to 6 patients in hospital with COVID-19. Many other provinces and certain states in the U.S. have much higher number of hospitalizations. So we do understand that PPE needs will go up substantially if we were to follow the same trajectory that some other provinces and the U.S. have followed. At the moment, we're trying everything we can through public health measures, physical distancing that all of us are observing to make the curve, keep the curve as flat as possible. But the health system obviously needs to prepare for a surge in cases and have enough PPE and other resources to manage that. So at the moment, my understanding is supplies are adequate for current needs, but planning is happening to meet future projected needs as well.
Thank you very much. Question for Verona. With employees that are still employed but currently have no work because of lack of demand. So the example they give is they have a driver that isn't able to drive anyone. Is it better to lay them off and let them access the federal funds, or keep them employed as a municipal employee? And we'll also let Bonnie answer this if you have anything to add.
Right. Well, of course, it sounds like it's a labor employment law issue. I would encourage, again, looking at how the community itself can support economic recovery, how those employees perhaps could be utilized in other ways. And that's, again, whether it's supporting businesses in terms of delivering product, connecting businesses to other supply chains, just actually determining the needs of businesses. I would imagine that these employees could be utilized, budget permitting, in other avenues.
Thank you. Bonnie, do you have anything to add?
Nothing to add. That's a good answer, Verona.
Perfect. Thank you. Our next question will go to Dr. Shahab. What would you recommend with respect to giving staff advice for municipalities that require 2 individuals to be in the same vehicle and to travel and work together? So this includes municipal employees who are out clearing culverts or ensuring roads are not being washed out, as well as we'll let Kerry answer it after.
Thanks. So based on emerging evidence, which means that individuals, first of all, most of the transmission happens when people are sick. So obviously, you should not come to work even if you have mild symptoms like a dry cough. Secondly, I think we need to look at every opportunity where people do not share a ride, where they can avoid sharing a ride. But if employees want to have an additional layer of protection, they can both wear a cloth mask. And what that will do is that if one person has asymptomatic or pre-symptomatic infection and coughs, then that may prevent transmission to his or her colleague sitting in the next seat. So to summarize, do not work if you're sick. Use all the other precautions as much as possible, physical distancing, hand hygiene at all times, including not traveling together where that can be avoided. But now this is a newer recommendation. Use a cloth mask for added protection to protect your colleague. And the way that works, of course, is that if you can't suppress your cough while you're driving, then a cloth mask would at least capture the droplets and minimize transmission, even if you were mildly symptomatic or asymptomatic. Thank you.
Thank you very much. Our next question goes out to all of the panelists, but we'll start with Kerry. How do we ensure that individuals who are vulnerable, such as homeless or at greater risk of getting infected, but don't have a place to self-isolate, can get access to the services that they need.
So the Human Service Ministries have done a great job in ensuring that there are additional services for vulnerable people or folks who would not normally have the means. Social Services is leading a lot of that response. Most of you will be near one of our offices. All 38 locations are open and receiving people. You can call our local office, and they are trying to make arrangements for individuals who need a temporary shelter space or who in fact are dealing maybe with some vulnerabilities and unable to service their needs for food or medical. So that's the first stop for anyone that you have in need.
Perfect. Would anyone else like to jump in on that?
I'd like to make a comment, Sean. Again, in some of the larger centers, we're seeing, again, specific teams set up to help this population, a particular sector of the population. Some of the hotels are donating rooms as temporary and even long-term shelters. So it's a matter of, again, I would recommend getting a committee together if you don't have one, or being part of your economic response team and coming up with some local strategies specifically to your community.
And Sean, it's Tim, if I could speak.
Yeah, go ahead, Tim.
I think in order for the province of Saskatchewan and the people within the Saskatchewan to be successful in dealing with this serious public health threat, we have to work together as a team. And when it comes to dealing with vulnerable populations where those that are having to self-isolate within their own homes, communities probably in most cases are already doing this, but they should be watching for that and lending a helping hand to assist those individuals in this time of need, and to bring food or pharmacy drugs or whatever their needs are to help them get through this time. I know that there are various community organizations out there that are already engaged in looking at this, and as well as the Red Cross and other support type groups that we really support community engagement in trying to get us through this very tough time.
Thank you very much. And just a quick follow-up for everyone. A question that was raised is, there are a lot of assumptions made that people will have access to phones and or internet to get the latest COVID information, but for several members of the province, this may not be the case due to poverty or other reasons. So what do you suggest for municipalities to help communicate some of this critical information to members that may not have access to services that will help them get the latest information?
That's Kerry. One of the great sources for those of us who are able to access the internet is the Government of Saskatchewan's COVID page right off of saskatchewan.ca. And Health has done a beautiful job of making a lot of PDF fact sheets and handouts, and I think we all would actively encourage municipalities to make use of their community bulletin boards. Any of those fact sheets can go up, and there's always the first source for accurate information, and whatever traditional non-technology means you might have at your disposal, any spread of accurate information is a help.
I would just like to add that many municipalities already send out newsletters that they may not send out electronically. They could be sent through the mail, or mail drop-offs too would be another option. Any way that the word can get out would be the best thing they could do. And like Kerry said, that there is a number of posters in that could be printed off the website and distributed.
Thank you very much. Our next question goes to Dr. Shahab. If you have an employee who has a family member who is being tested and they have direct contact with that family member, should that business close until the test results come back?
Yeah, so at the moment, what the recommendation is that if you are a person who has become symptomatic, you should self-isolate immediately and seek advice from a health line regarding further testing. If your test results are positive, you would be under self-isolation till your symptoms improve and you've recovered, at which time you will be cleared by public health to not remain in self-isolation. All close household contacts are also to go in isolation for individuals who test positive. Having said that, I think it's a good idea for anyone who may be a close household contact with someone who hasn't tested positive or who is an otherwise contact, maybe in an essential workplace. They will in any case be contacted by public health if the case was positive, but as an added precaution, everyone who is in the household should be very self-aware and self-monitor for symptoms. People should not actually be going even to work in an essential service where you are not maintaining that physical distance or not using maybe a cloth mask now. But that's another reason where even if you have to be out and shopping or working in essential service, even if you're asymptomatic and closely monitoring your symptoms and isolating at the first sign of any symptom, however mild, as a household member, like if you develop a cough, you should isolate. But even if you have to go shopping or do other work and are not required to be in isolation at this time, maintaining that physical distance, observing good cough etiquette, good hand hygiene, and now with the newer recommendation of using a non-medical mask, maybe additional precautions that can prevent you as a household member of someone who hasn't been confirmed to be a case of not transmitting COVID-19 inadvertently if you were asymptomatic or mildly symptomatic. But once your household member is confirmed to be COVID-19, you will then have to be in isolation as a close household contact for 2 weeks. And at this point, public health is giving clear advice on that. But I think as a general rule, even if we have a household member, a child who is coughing and not well and may not be required to get tested because the symptoms are very mild, it just means that all of us need to be very self-aware of our own symptoms and minimize any external interactions that may expose others. So we may still go to work, but may want to use, like I said, a cloth mask. Ross, would you want to add anything to this?
No, but I think the original question started from should you shut down a workplace where the contact was? And I think the answer to that is probably no, until the situation with the first person to get sick is a little clearer. Part of the problem here is that there's a milder end of the disease than we were originally aware of. And so that's one of the things that is driving some changes in the recommendations over time.
So thanks, Ross. So the way I will rephrase this, and thanks for reminding me to listen to the question, is that no one should be at work if it's not essential work. The very nature of essential work is that that work is required to maintain essential services. So public health will in any case contact close contacts in the workplace, and really the way we should practice social distancing in the workplace is that you shouldn't have any close contacts in the workplace, so that if you get ill, there was no one who you were within 2 meters of, who you shared a meal or anything that was handed back and forth. You should minimize that even to begin with, so there are no close household contacts. But having said that, other people who are not close contacts but maybe in the same workplace, and that happens, of course, for example, in a grocery store or other setting, or healthcare, or trucking industries, for example, they would be under active self-monitoring either on their own or by their employer, or if they're a larger workplace, by their staff occupational health. So they would be active self-monitoring, including health checks, and be asked to isolate at the first sign of symptoms. But like Ross said, using a cloth mask for those who are coming to work in that environment consistently may further reduce the risk of others who may be mildly symptomatic, asymptomatic from further transmission to others. But again, it depends on what kind of work you're doing. How long can you tolerate even a cloth mask and those kind of things. So some of that has to be individualized for the workplace setting. If you are working more or less alone with more than a 2-meter separation from others in the workplace, and there may be some industrial operations that is done, a cloth mask may not be required as long as everyone else observes good hand hygiene when touching common surfaces like doorknobs and when using the washroom, and minimize that hand, eye, mouth, nose contact at all times without proper hand washing and hand sanitizing. Thanks.
Thank you very much. We have a quick follow-up. Is there any course of action that municipalities should or can be taking for members of their community that are not following self-isolation laws?
Tim, do you want to take that first?
Sure, I'll give it a try. I think definitely it's in line with some of the previous comments that community members, municipalities are encouraged to have discussions and try to educate individuals that are not complying with the provincial public health order. Again, we're all in this together, and we're counting on everybody to try and assist in getting compliance with the order. Should there be significant pushback or problems, definitely there's a route that can be taken for a more formal enforcement, but we want to try to prevent that as much as possible because of the limited resources that are directed to formal enforcement. But I think the first step is for municipal officials and members of the public to self-police within their communities.
Thank you very much. This next question goes to Kerry and Bonnie. With the federal and provincial parks being closed until further notice, is there the same order for regional parks across the province? And if not, can we get some clarification on what the rules for regional parks are?
That's Kerry from the SPSA. That decision provincially was taken to make sure that we are supporting and being proactive of following those health measures, and then an acknowledgement that if those places weren't accessible, that we would then not have so many issues with actually ensuring that folks don't congregate there. So probably either Tim or Dr. Shahab can probably speak to that on what they had envisioned, some of the potential risk being in having those places remain open, if that's all right.
Thanks. So maybe I'll make a few comments and then hand over to Tim. So I think we need to recognize the Saskatchewan advantage where if you are asymptomatic, not required to be on home isolation as a case or contact, it is really important for our physical and mental health to take solitary walks either as individuals or as households outside while maintaining that 2-meter physical distance from others. That can mean taking a walk outside in your own neighborhood and trying to walk around more quiet streets. We don't want to encourage people sitting in a car, even as a household, and driving to a popular spot to walk there because that does encourage crowding. So as long as individuals follow reasonable steps so that they can enjoy the outdoors, especially as spring is coming, while maintaining that physical distancing and especially keeping an eye on their children and pets to minimize that inter-household mixing without that physical distance. So obviously wave to your friends and neighbors, but not get closer than 2 meters. So that physical distance, but social cohesion is important. As long as that is maintained, we should enjoy the outdoors. I think in other provinces where you have large urban density and the municipal green spaces can get very crowded, I think they did take some steps about discouraging that. And also, I think there may be some risks where there are public facilities, either washrooms or other facilities where multiple people may be touching door handles which can't be kept clean, where there may be a transmission risk. So I'll maybe ask Tim to maybe expand further on how to minimize those risks while enjoying the outdoors.
Yeah, thanks. So specifically to campgrounds, a couple of approaches have taken place. The Ministry of Parks and Culture and Tourism, I believe is the proper name, have made the decision to close all provincial parks, and they may have also conveyed that message to regional parks because they certainly have a connection with regional parks operations as well. The message from public health to campgrounds is that at this point in time we're asking them to remain closed because of some of the things that Dr. Shahab already said in terms of common washrooms and the concern about transmission through multiple touch points of door handles and faucets, levers, and so on. So at this point in time, the message is that they're not to open.
Thank you very much. This next question goes to Verona and Bonnie. There's a question about in a post-COVID-19 world, what should municipalities be keeping in mind for their economic recovery plans, as well as are there any plans with the government to have a joint municipal provincial government task force for economic recovery?
I'll start if you don't mind, Bonnie. Actually, my organization and the Saskatchewan Chamber have been working fairly closely over the last 3 weeks, and we did approach the municipalities of Saskatchewan and SARM to see if they would engage in a task force that would complement the province. We're waiting to hear back from both of those organizations right now. I personally feel the province has been doing an outstanding job. Their business response team is centralized resources. And I know on the labor side, they've been providing even instruction help on filling out applications. So I think that's really been phenomenal. At a local level, we need a plan to move forward, and that plan, that planning should start now. Back in 2008, after the big recession, a lot of jurisdictions across North America recognized that they needed to go back to focusing more on their local and regional economies in terms of the food system, in terms of the supply chain for businesses. I really feel that communities working together with other communities in their trading area need to look at a regional economy as we're moving forward and start that process now. I would be prepared to start fast-tracking permits as we start to come out of this. I would be looking at community investors groups or establishing an economic development foundation, a charitable foundation or a co-op. And these are some of the options that we can help you with as well. As we mentioned earlier, the tourism industry is going to be really interesting phasing that back in. And that's really a viable sector for almost every community in Saskatchewan. So we have to work with the government of Saskatchewan on that to see how we can phase that sector back in as quickly as possible. I definitely would be waiving any home-based business bylaws if they're in place across Saskatchewan right now. I hope that that's a consideration that's already being addressed. And there's other specific business supports, again, maybe encouraging businesses to start their own barter pay system to support each other in terms of an exchange of services and products, seeking out consultancy firms that might be able to provide free technical assistance. CETA has developed a short list ourselves, but perhaps there's local and regional private sector consultants in your area that could be supporting businesses moving forward and re-looking at their cash flow, scenario planning, that sort of thing. Those are just some suggestions top of mind.
If I can just add to that, the ministry always encourages municipalities to work together for the betterment of all citizens. Many of you may recall that prior to COVID-19, there was some voluntary cooperation meetings happening around the province. They were canceled due to COVID-19, but they will resume post-COVID-19. The other thing I wanted to touch on is that municipalities we've always encouraged them to have, and maybe more so now, is a business continuity plan, so that if something was to happen, what could be done. So at the present moment, the province, in conjunction with SARM and with municipalities of Saskatchewan, are working together. I'm working on putting together a document to distribute to municipalities to help them put in a business continuity plan. So thanks for the question.
Thank you very much. And I just will add that with many of your employees working at home, you can make use of your downtime at the moment to put together some of those plans. This next question goes to Dr. Shahab. Is it fair to convey to the citizens of Saskatchewan that even if we reach a state where we have 0 new cases in the province, or our social distancing measures will not be loosened until we see the rest of Canada and perhaps the world do the same thing, so see 0 new cases?
So I think, like I said earlier, we are only in our 4th week of this pandemic in Saskatchewan. Our first case was announced in the 2nd week of March. And the rest of Canada is maybe in their 8th week. The world globally is in their 3rd month. So obviously there's been unprecedented actions taken by governments at every level, municipal, provincial, national, throughout the world. I think we will need to watch very closely about how the pandemic unfolds and what measures may need to be tightened and what can be relaxed and when, and how can we then monitor the impact of relaxing some measures and keeping a close eye on does that cause an increase in transmission. So I think these are important points for the near future, but it's hard to actually predict anything at this point. But obviously, like some of the panelists made the comments earlier, we need to keep an eye on the short time frame, which is 2 to 4 weeks, which is sustain the current measures. We also have to look at the medium term horizon, end of spring, summer, and also the more long term forecast over months to years. It's too early to say specifically what measures will be relaxed when. But obviously, we need to keep a close eye on what we are seeing in Saskatchewan, how this is unfolding in other parts of Canada, what's working well, what are some of the challenges, and also learn from our partners globally as well. So I'm sorry, that's the best answer I can give at this point. But obviously, every week and every month, we learn more, and we can, give better advice to what we can anticipate for the future. Thanks.
Thank you very much, Dr. Shahab. Our next question is for Kerry, and anyone else can feel free to jump in. Do municipalities have the authority to tape or barricade areas off that they may see people having public gatherings? So the example they give is beaches. Should they be taping those off, and do they have the authority to tape them off?
If the property is the municipality's property, I understand that they are able to do that. I know in my center, we can see the city of Regina has done some of that with their parks that they manage and own. Again, you'd want to be very careful that you're not creating an additional safety hazard, so thinking about what you might use to deter entry to those points.
Thank you very much. The next question, let me just pull it up here, is are there plans to centralize communications? Municipalities are saying that they're seeing a lot of information come from various sources in the government, and they're looking for one specific place that all communications will be centralized through. So Bonnie, do you have any comments around that?
Well, we've been directing municipalities to Saskatchewan.ca because there's a ton of information and it's good and reliable information there. I'm not sure exactly what they're referring to. If they're referring to the information that comes out from government relations, we in those communications we do refer them back to Saskatchewan.ca. If whoever asked that question, if they wanted to contact me offline, we could talk a little bit more about it. I'd be happy to do that too.
Thank you very much. A quick follow-up. Due to the financial impact of diverting so much money towards health to contain the pandemic, are there any plans or is there any risk that the province may have to change the revenue sharing formula to reallocate some funds to the crisis?
That's not being contemplated.
I apologize, you folks are going through questions very fast, so I am trying to find the next one that we haven't already answered. This one is for Dr. Shahab. As our first responders, such as our volunteer fire department, or should our first responders or our volunteer fire department be required to be fit tested for N95 masks in the event of an extraction of a motor vehicle accident?
So again, I think there's some further specific guidance for infection prevention and control through the SHA, which also includes first responders and EMS. So certainly the guidance generally is for the public, and I'll start from there, is that, you know, if you have symptoms or not sick enough to require urgent care, call helpline to assess if you need to be tested, where you go to a specific site. And then if you need urgent care, you may call ahead before going to an ER, or if you're short of breath and need immediate care, you may call EMS, and then EMS will come with appropriate PPE based on your situation to assess and, if required, transport. Now here we're talking about a situation where someone is not a person ill with COVID, but he is, they need some rescue. So my suggestion would be that at this point, just routine precautions be observed, which may include a quick review of symptoms if that's possible, or the use of a cloth mask by either the responders or the person who is being extracted, that they, if they are able to, they could use a mask to, so that even if they were symptomatic and didn't know about it, it would protect others who are closer than 2 meters from exposure if there was an unknown asymptomatic infection. Beyond that, I don't have the details of what kind of PPE first responders have, and obviously they need to conserve that for when they have to respond as a first responder to a health concern, and not use PPE unnecessarily where the risk may not be there. But certainly I can understand where you may have to get within 2 meters of someone who is not otherwise sick with COVID-19. So in those situations, if the person can be offered a cloth mask and wear that, that may provide some additional protection beyond other measures that minimize that within 2 meter interaction while other extraction processes are happening. So it's not a very good answer, but I think that's the best I can give at this point. But I'm not aware of the protocols that fire, police, and others have developed as first responders. I know EMS has a very specific protocol, but then they also have to transport sick people to hospital who may be short of breath and may require other interventions requiring medical PPE use. But I think this is a good question to take back, Tim, for follow-up with first responders, including fire, police, and others, about what protocols they're following. Thanks.
That's Kerry from the Public Safety Agency. We did have a town hall with first responders, so both the paid and volunteer fire departments, as well as police throughout the province, and the representatives for EMS. And this was a question that came up. So Dr. Shahab, there's already some additional work being done here For the leaders on the call, I'd like to give you some comfort that our agency is in weekly contact with all of the police services. We also have very regular contact with the paid fire chief, as well as the Volunteer Association. And as the situation changes, those communications may help provide some additional guidance to them, but those first responders have as direct connection to us as they can, given that especially in smaller communities, they do a variety of work that's very different from the urban centers. So hopefully that gives you some comfort. We've also made arrangements with them so that they understand how they can order PPE and several other things.
Thank you very much. Our next question goes to Dr. Shahab again. Are there any plans to release more specific information on positive cases specifically to municipal leaders so that they can better prepare their communities for possible outbreaks?
So yes, as the pandemic has evolved in Saskatchewan, 4 weeks ago, our only cases were returning travelers and their close household contacts. We did predict that over time we will see more community transmission, and so we did see a transmission linked to mass gatherings and events, but those no longer happen. But we do see cases now that are due to local transmission. So that means that people cannot identify where they got exposed. So from that perspective, it is not really useful for individual cases, in terms of individual cases, to really inform municipalities about where an individual case lives in terms of testing positive, because really the risk is throughout Saskatchewan and we all have to behave exactly the same. Having said that, if there's a situation where there's a cluster of cases which may require some additional supports by other partner agencies, which may include municipalities, public health will then involve the appropriate agencies, which can include municipalities for assistance, in which case, obviously a lot of that information is kept confidential in terms of who needs to know, but municipalities will be engaged when there's a situation where either communication needs to go out more broadly because all the contacts cannot be identified, or where there's a situation where there's ongoing community transmission which cannot be controlled due to a variety of factors, in which case public health will obviously reach out to municipalities and other partners for better coordination of response. And I'll ask maybe Tim if you wanted to add to that as well.
No, I think that's adequate. Thanks.
Thank you very much. Our next question is for Verona and Bonnie. For Bonnie, will there be additional funding made available to municipalities for the added costs they're taking on to incorporate these extra measures, including things like mail drops? For Verona, what do you suggest for municipalities to best make use of a limited budget for providing additional services?
I'll start with that one. The answer is I can't answer that at this time. I don't know of any additional funding. Thanks for the question, and I will definitely take that up to senior management.
Budget is always an issue. I manage a very lean organization myself that receives no public sector funding, so I can relate to the attendee who asked that question. And maybe it goes back to as well, best utilization of your current resources. What members of your team can be allocated now to putting a plan in place if there's not one already for economic recovery? Can you bring together your local leadership in the community, your informal leaders from the business, as well as your general community, to volunteer their time? Perhaps there's some retired business owners that could be brought in. I really would encourage a plan that focuses on existing resources and not postulating on funding that may not arise or materialize. When it comes to economic development, there really is not a lot of project funding in the province. So I feel any resources now should be focused on planning on how you can leverage the resources in your community. I know that's a real general answer that doesn't sound entirely helpful. I'm available offline to consult with any communities in that regard.
Perfect. Thank you very much. Our next question goes to Dr. Shahab. What can municipalities be doing to help support SHA as well as the Ministry of Health in fighting this pandemic?
So I think, as Tim also said earlier, we are in this all together, both as individuals but also as organizations. So, and I'll ask maybe Tim afterwards to expand on that. But I think so far, in general, I think we have seen a response that is unprecedented at the individual level and at the business level and at the government level, both municipal, provincial, and nationally, in terms of solidarity with observing public health orders and recommendations. Obviously, we hope that things remain as they are and continue for a while, and then we can ease off. But if things will start becoming a bit more concerning in terms of increasing cases, then all the things that we've discussed in terms of maintaining the course in terms of physical distancing, supporting those who need help, whether they are seniors who live alone and need some psychosocial support, which doesn't invade that private space, but may include, staying in touch by other means or even from outside the house and checking in on neighbors and providing some essential services like groceries and pharmacy supplies, plus also additional support for people who are otherwise unable to maybe self-isolate when required. So everything we've discussed may be required at an even greater scale if our curve doesn't remain flat, and I think we just need to be prepared to respond at that level as well. Obviously, the health system is preparing to be able to respond to a larger number of cases if that should come. So in closing, I'll just say that we hope that we can keep the curve flat, but obviously we have to be prepared for other eventualities as well. And maybe I'll ask Tim to add to that.
Sure. I totally agree with what you just said, and said it very well. I mentioned response to this previously. I think the only thing that I would add is that I think much of the non-compliance that we see occurring is due to people not understanding the need to follow the order, or they are not aware of the order, or they're not they don't understand the consequences of non-compliance with the order, both from a enforcement perspective, but also more importantly from the transmission of COVID-19 perspective, and whatever community members can do to help inform individuals of the need to do things like social distancing and self-isolation, I think that should be encouraged.
Thank you very much. I will note that we are quickly coming up on 11:30, and we still have over 40 questions in the Q&A pod. So I'm just going to apologize right now to all of our attendees. We're not going to be able to get to everyone's questions. However, we are going to take two last ones, and then we'll give each of the panelists an opportunity to wrap up and share some final thoughts. So this next question goes to Kerry, but also to health. Are there adequate supplies for funeral workers, funeral home workers in the midst of this pandemic? It appears in the wake that funerals are still going on, and in First Nations communities, there's a concern that funeral workers have to go in without protective equipment. So can you share any thoughts or suggestions for these communities?
Specifically, I'm not sure where the supply is for funeral homes and funeral workers. I can tell you that all of the non-health PPE is being coordinated by the province, and that there is an access point for them to make requests if they or their industry comes under pressure. We do know that First Nations, Inuit Health, and the Indigenous Services Canada Chief Medical Health Officer did issue instructions to First Nations, went directly to the chiefs, trying to communicate to them how they need to practice wakes and funerals differently in order to minimize the risk to their community. We are aware that there has been changes made in a couple of the locations where they know they recently had events and they were able to comply. RCMP are monitoring any events that they become aware of, not just on First Nations communities, but in all locations. Funerals are a sensitive issue, and we certainly want to be compassionate to families that are impacted and at the same time balance the needs of the community as well and make sure that we're behaving appropriately.
It's Tim, if I could add to that.
Go ahead, Tim.
Certainly, there's information on the website that speaks to funerals and what to do with funerals. Definitely, we're encouraging delays of the funeral ceremony if at all possible. That's if the individual is cremated, then I think that's easier to delay than other situations, and there may be other religious beliefs that become a factor on this. The ministry has been working with the Funeral Home Association in regards to discussions on PPE and what the needs are, and certainly there's ongoing communication between the ministry and the Funeral Directors Association in that regard.
Thank you very much. Our last question is the audience has asked if each of you would share some best practices you would recommend moving forward for their municipality to best weather this pandemic. So we'll start with Bonnie.
Thanks for the question. Best practices. Well, I spoke earlier about a business continuity plan, and I think that's in place no matter what business, government, whatever needs that. I would also say that to be leaders, be proactive, be leaders. Right now, your citizens, your community need your leadership at this time. So sometimes it may mean you need to be ingenious when it comes to holding council meetings and meeting all the legislative requirements when it comes to assessment roles and that. But being as open and transparent as you can with your public is going to go a long way at this time.
Thank you very much. Next, we'll go to Kerry to share her best practices.
Well, the number one thing we can all do is follow the directives that Dr. Shahab is providing for us. I'd also like to remind municipalities that you're coming up on a normal season that may present challenges for you, which is the traditional storm, wildfire, grass fire season. And I want to make sure that everyone is aware that our normal arm that assists you with those events is still functional. We'd encourage you to do some communicating, especially if you have ag folks around you who will be looking to burn stubble, to make sure that your fire ban and permit process is visible and on people's minds. Other than that, just generally take care of yourselves. You're carrying a heavy burden, and it's difficult when you can't please everyone and you're trying to at the same time look out after everyone. So please care for yourselves, access supports that are available to you. And if any of you need anything, you can always reach out to the Public Safety Agency, and we will connect you with what we think we might be able to get you what you need.
Thank you very much. Verona, we'll ask you to share your best practices.
Well, building on our other two presenters thus far, again, what we're facing now is unprecedented. However, best practice in terms of a disaster or a business interruption, community interruption scenario is to get an economic recovery plan in place and make sure it is integrated with your EOC. Hopefully there will not be anything over the next 2 to 3 to 4 months that communities will have to face, such as a wildfire or flooding. But having a economic plan integrated with your EOC is really key. I know this is somewhat daunting, but the more we can work together and again, what we've spoken to earlier, try to eliminate redundancies, working together with the province. We're here to support you in moving forward.
Thank you. We'll go over to health. If you individually all have best practices, you certainly can share them, but if not, we'll start with Dr. Shahab.
I'll just briefly say that I think we have seen, unprecedented collaboration, and we have rediscovered our strengths in Saskatchewan as individuals and communities. And I appreciate the comments earlier about, business revitalization and a regional approach. But I think we have discovered many strengths that we had through this challenge, and I think we need to build upon that. And with that, I'll hand over to Tim and Ross as well.
Go ahead, Ross.
Yeah, we're not too talkative. I think you said it very well. I think the other idea is this will pass. Like most of these infectious disease challenges. I mean, it's a very unusual circumstances, but this will go away, and we'll be able to get back to normal life eventually. I guess my only other thought is think of those people that are having trouble coping with this, whether it's an elderly neighbor who doesn't have access to the internet or some other circumstance.
And it's Tim, just to close off the comments from health. I just want to remind folks that there's a lot of information up on the government website dealing with COVID-19. If you haven't visited the site, I encourage you to do that and become familiar with what the information is there. This is a rapidly evolving situation, and so there's always updates and revisions being made to the documents on the site. But please familiarize yourselves with the site so that you can go to it to be kept informed. The other thing is that if you have any questions in regards to matters that perhaps weren't addressed today or others that come later, there is an email address, covid19@health.gov.sk.ca, and I'm sure Sean can make that available later for you to be able to send in inquiries to that site, to that address. And then I know that Kerry had mentioned the SPSA enforcement line phone number that is available for non-compliance type issues. And then finally, I would just encourage all to be working together with not only within your municipality but neighboring municipalities, and don't allow jurisdictional boundaries to get in your way to when we're trying to deal with this issue. Thank you.
Thank you very much. As you all know, there's a lot of information available on COVID-19 out there. We encourage you to go to all of the websites that were referenced today, and we will certainly include those into tomorrow's webinar recording, which will be emailed out to all of you. Municipalities of Saskatchewan is committed to supporting Saskatchewan's hometowns by providing access to the information and resources that are important to you. As you all know, we've created a hub on our website to answer your COVID-19 questions and keep you updated. This hub includes information important to you as an employer, links to resources, including an infectious disease policy sample, and more. We're going to continue to update our COVID-19 resource page with additional information as it becomes available. I want to remind everyone that next Tuesday, the Saskatchewan Health Authority will be hosting a webinar with us at 2 p.m. So you can keep your eye out for the registration link for that later this week. This brings us to the end of today's webinar. I just want to give everyone a chance to share some final thoughts if they have any that weren't encapsulated in the best practices. So we'll start with Bonnie.
Thanks, Sean. In closing, I just want to say that government relations services to municipalities continue as they did prior to COVID-19. And I know that in my branch, municipal advisors are one of the first stops. So please feel free to contact municipal advisors. It's the same number, 306-787-2680. Nothing's changed. And all of your inquiries will be responded to. And thanks for asking us to be a part of this webinar.
Thank you very much, Bonnie. Your input today has been really helpful, and I hope all the municipalities were able to get something out of it. We'll go to Dr. Shahab and Tim.
Nothing further for me, and thank you, Sean, for really moderating this really well. And I know there were lots of questions and interest, and I hope we were able to address some, if not all of them. Thank you.
Yeah, and I just echo that. Very much appreciative to have this opportunity to talk to the community leaders throughout the province, and I hope all of you keep well, and we will persevere and beat this.
Thank you very much. Last but not least, Verona, do you have any final thoughts to share?
Well, good job today, Sean. Thanks again for the opportunity to participate. Again, any communities, don't hesitate to reach out, and just keep the faith.
Thank you very much. Well, we encourage all of our attendees to take a few minutes to fill out a short survey so that we can improve our upcoming webinars. That's it for us today. Like I said, we'll be sending out a recording here tomorrow, and we encourage any of the panelists, if they want to send links to be included in the email, they can certainly do so. So look out for that in your inbox. It will be coming tomorrow. I just want to give a huge thank you to all of our panelists, especially Dr. Shahab for making the time to talk with us today, because he has an incredibly busy schedule. So this was really a treat, and we hope you found this information useful. Everyone have a great day.
Thank you very much.